My name's Paul Woodington. I've been with MAF for 15 years, and today we brought in the Area Health Patrol from Kompiam, and this is one of my favourite airstrips. It's only 600 metres long. It's got a slight upslope. Stuck in this valley here, it's got its own little weather climate, and at the end of the week, I'm going to pick everyone up again, hopefully, if it's not raining.
I'm Dr. Rebecca Williams, and I'm the doctor at Kompiam District Hospital. Our routine patrols, we fly out on a Tuesday, and as soon as we hit ground, we start off doing the clinic Tuesday from about morning or mid-morning to the evening, wake up the next day, and then we do clinic until the plane comes back and picks us up.
So we've come out with a team to Malaumanda. At Malaumanda there isn't an aid post or a clinic, but there is a couple of village health volunteers who do medical work here, and they try and send a team up maybe once or twice a year to just try and support the health workers here.
Name belong me Diane. Me belong Malaumanda. Me work long VHP, village health volunteer. Me say give him marasin, time all sick. Me say scale him, me say give him long all.
I think just in terms of Papua New Guinea as a whole, most of the people live in the rural areas. Probably 80% of the population is in the rural areas, and that's not where the doctors are. Most of the doctors are in towns, and actually there's only 500 doctors in Papua New Guinea for a population of 7-8 million. A lot of people out in the rural areas, they don't have anything.
On a routine patrol, we'd have a doctor or HEO, CHW nurses, someone from the dental team, and we'll have a pastor with us. So that would comprise a normal team on the patrols. I think the idea about having a pastor along and other healthcare workers along with us is that we also want people to get that holistic healing. Not everything can be treated by medicine and by seeing a doctor. There are some things that are spiritual, and also we want people to know Christ. That's the whole point of all of these patrols and going out, that through our actions and through us coming out to serve the community, we may be a reflection of God and people may come to know Him. So today, this morning, we're going to split our team up. Our two nurses, they'll be giving vaccinations for the kids, and then myself and the other doctor will also be seeing general patients at the clinic behind me today.
End of last week's Sunday and start.
This is really bush medicine. We just came with a few supplies. So a lot of our work here is based on talking to people, getting the story of what's going on, using clinical skills of examining people and trying to make a judgment about what to do. And sadly, there's a lot that we can't do.
Most of the patients that we see in our rural patrols, they're chronic illnesses sometimes, maybe like a bit of arthritis or fungal infections, but mostly infectious diseases. We sometimes get TB in areas that have a high incidence rate for that, some malaria. It varies. In the highlands, less malaria; in the coastal areas or warmer areas, more malaria. The further out from the center we get, malnutrition starts to become a problem as well.
Lo Australian bund lo mi sa pen mi sa walk na mi sa ad lo limpikini kai no sem now o community plabel pumina mi kam life long lem hard street na in no road lo car Na network mi plus a pine go mountain, some like mountain and stuff.
Time baby come out at finish time and Rosim bell problem. Pass him also. Now wait. Now peel him this la coat, blood them stop, pass him strong. Then you sim this la talk save lo em said mama who said by staff one them you. Okay mosem little blade by staff sim cutting.
We have various challenges from the community. People can ignore you, and sometimes they can welcome you, but we put ourselves into their shoes, and we can humble ourselves. This place is very remote to us, but when we come here one by one and several times, their living standard of living, they're improving.
Nemplomi I'm Jim Balus, Mimplo Malaumanda place straight. And big plan need MOSM. No one doctor, feminine doctor or dislakan I'm no straight. Road highway I'm in Ogat, now radio 2 I'm in Ogat. I'm all give him cyclomipla. I miss I go network place 3 hours from Malaumanda to top mountain. Na mountain from mountain to here I'm 3 hours, I'm 6 hours.
Think of a mum who's in labour or someone who's sick and can't walk very far. It's great that MAF and other organisations are serving these rural communities and providing a vital link in terms of access to healthcare and education and to the gospel as well.
When I first came to Kompiam, Dr. Mills, he was doing walking patrols out. We have a few sites that are 1 or 2 days within walking distance from our district hospital, so he was already doing that. And then I think maybe 2018, MAF started sponsoring us to actually do flying patrols out, which was really good for us. With the foot patrols, obviously, we're taking more time away from the hospital. And if there's only one doctor at the hospital at the time, that means we're away from anything that might be going on. We can't cover the district hospital. With the flying patrols, it's easier. We get out, see who we need to see, and then come back in a day or 2 time. So that's been a big advantage for us, to just be able to reach more people, I guess, in our community or in our area.
I'm help me alongside go house sick. Na bring him all some workman blo house sick or come sell place blo yumi na missionaries.
Online Kompiam come na help me. Now line me long sambla more marasin long we can give him all people blow me. Big play through all come help me na me to me amamas.
We saw a good number of patients, maybe about 9 the first day, 19 the second day. And I think yesterday we probably saw maybe 15 or 20, somewhere around there. So for a smaller community like this, those are pretty good numbers, and we were able to vaccinate quite a lot of people, so that was also good for us. Today on Thursday, we're going to go up to the school, give some health education for the students. We'll be focusing on TB, HIV, family planning, and then I'll talk a bit with the students about career paths, schooling, all of that. That's always good for a community like this, to know what options they have. Answer any questions that they might have for us, and then we'll head out when the plane comes.
No what place balus. Mi place hard. Find him hard. This lap side mountain and bush. Na ba mi pla go lowe. Mi pla legally community tasol. Na mi place a film cry. Na you pla come and big pla how much to me. And big pla help him straight. You pla kisim big pla service come said. Bell blow me and big pla ma sleep pla. Big man am looking bell blow me.